welcome back to my channel. Thank you for joining me in another video. In today's video, Josh and I are going to talk more about what ketamine is, and I am going to share my experience. I actually have Josh here to explain what ketamine is and like the science behind it, because in my last video, I did not do a very good job explaining it. He knows more about it, like how it works in the brain versus a little bit, like versus what I know, or like how to explain it. He's really good at explaining that type of information, and then I will just kind of touch base on what to expect at each appointment, how they work, and then again, what each session looked like for me while I was on the ride, as they call it. If you guys are new here, I will link my previous video down below that kind of explains why I'm doing these ketamine treatments. I've struggled with mental illness for pretty much my entire life, and ketamine is kind of like a newer treatment, like on the rise, I guess, for treating depression, anxiety, PTSD, and chronic pain management, things like that. And so I have depression, anxiety, and was diagnosed with BPD, or borderline personality disorder, in 2012. And I have done, lots of therapy, lots of different medications, and all of those were kind of just like a Band-Aid. Do you want to take over and kind of explain how ketamine kind of works, or what you know about it?
Sure, I'll try my best. I'm not a scientist. It's not medical advice.
Yes.
Probably going to butcher lots of stuff, but I'll try to help explain a little bit from what I understand so far. And, part of my kind of researching this as an option for you, because like she mentioned, she's been struggling with mental health for a while, and, I've, of course, experienced that firsthand. Being married to her, so I want to, always trying to help find new ways and treatments, and different things that can help, just make it better, and make her life and her experience just that much better, right? So we're always looking for stuff that's going to work. And you did, you've done therapy in the past. You've done talk therapy and DBT, and there's a whole bunch of CBT,
and EMDR, and
there's lots of different therapies, that you've gone through and tried, and some of those have helped, right? I mean,
absolutely.
You've seen improvement from those, and you've taken medications that, some were terrible and made you feel worse. Some maybe helped some symptoms at the time, but didn't fully, solve everything. Some maybe just didn't do much at all. So kind of hit and miss on the medications, but I think we've seen improvements over time, but it's still there, right? Like the baseline kind of issues are not cured or healed completely, just from those kinds of treatments alone. So always kind of looking for the next big thing that can maybe help kind of resolve it once and for all. So that's kind of where ketamine came in my search to find the next thing. Like I said, it's sort of an emerging treatment in the mental health field to treat depression, especially treatment resistant depression that doesn't respond to the other medications and therapies and whatnot. Chronic pain, anxiety, like you mentioned. There's lots of other potential uses kind of in that sphere of mental health, where they're seeing some progress and some breakthroughs. But ketamine itself is a drug that's been around for a long time, so it's nothing new. It's been used in the ER and other places as like a anesthesia, basically, right? So they use it in the ER to put you under and basically knock you out unconscious, so they can do whatever kind of treatments they need to. So it's been commonly used for a very long time, and part of the reason I think it was used, not only is it effective at knocking you out, but it's relatively safe as well. So it's well tolerated. There's very little risk in using it. There's not a lot of side effects. So it works well in that regard. But more recently, over the last handful of years, it's been discovered that at lesser doses that don't quite reach the level of full anesthesia, there seems to be some effects on the brain that lead toward improvement in experiences and conditions that revolve around mental illness. So that's kind of where that's, the treatment sort of came from. And so that's, it's been over the last several years, I think that was kind of discovered as this could work for this stuff. And there's been lots of tests and trials and research that's gone into using it for this use case. And so that's kind of where we are today. So there is one form of ketamine that's been approved by the FDA for treatment of mental conditions like depression, treatment-resistant depression specifically, and that's the Spravato, I believe, is the brand name. And so that's like a nasal, inhaled form
Mist.
of it.
Yeah.
It's a nasal mist. So you just kind of inhale that, almost like an asthma inhaler, if you will, something similar to that, to kind of take it in that way. But there are other methods to using the ketamine to achieve this kind of therapeutic effect. So there's, IV treatments, or you can get it intravenously through a drip IV, which is what Brittany has started to try, and that's kind of the most common, it feels like. And there's a lot of treatment centers that have popped up to really leverage that option. There's you can go the oral route, so there's like dissolvable tablets that you can take to get to that reasonably effective dosage, and then there's this Spravato. So that's been part of the struggle, is that it's an interesting treatment that sounds like a breakthrough cure in a lot of cases. I've heard some studies refer to up to around 80% or so of people with chronic depression and these types of symptoms have responded to this treatment, and many of them are actually cured from it, right? So it goes into kind of remission, and it never reappears, which is, mind-blowing, right? That's awesome to hear, and it's you don't see a lot of cases where you can just kind of cure something like that out of nowhere, it feels like, and especially with something that has a really nice safety profile and has been used and studied for a long time. So that's pretty cool, but it's not that easy to get approved, unfortunately, for insurance. There's not many, it's not approved by the FDA except for that one form, which is relatively new. It's expensive. It's hard to get insurances to approve it. So that's kind of the issue right now. It's not necessarily the effectiveness, because that seems to be pretty well proven at this point. It's just the accessibility.
Right.
You either have to kind of battle with the insurance companies to show that you have this long history of trying other types of treatments and medications before they'll approve it, or you have to pay out of pocket, and it's not cheap to get at all, and it's not easy to get. So it's just really a matter of accessibility, which is unfortunate, because it does, from all indications, appear to be the potential kind of breakthrough treatment and therapy. So hopefully in the near future we can find ways to make it more accessible to everyone, but that's kind of where it stands right now.
Yeah. So do you know exactly like the terminology or the explanation of what happens to your brain while you are...
Well, again, I'm not a scientist or anything close to it.
Disclaimer.
So
this is just us, what we've seen on YouTube, what we've read up through Google.
I've read a few
research.
I've read a few scientific studies. I've listened to doctors kind of in their testimony on experiencing it in clinics and with patients, and firsthand experiences of folks that have used it. So we've done all that kind of research. So I have a general sense, but to be able to repeat it back in clinical terms, I'm not that guy.
Yeah.
But basically my understanding is that it helps impact what they call neuroplasticity, right? Which is making your brain malleable and flexible, right? So if you think of depression as, depression's a lot of things to a lot of people, but there's a lot of symptoms, a lot of factors that go into it, but a lot of it, I think, is, and correct me if I'm wrong, because you experience this more than I do, but it's kind of not only is it that, negative impending doom, sadness kind of mindset, but it's also getting stuck in a repeated pattern of thinking where, you have like these triggers that, increase depression or make you worried or anxious or upset about something. And then you go down this kind of rapid thought process of like going downhill and spiraling out of control toward, either not caring or not wanting to do things or being upset by everything. Like, that's my layman's interpretation of kind of what that is, right? But I think that's consistent, and you kind of get wrapped up in that unfortunate cycle and mindset. So what ketamine sort of does is take that kind of repetitive path and cycle that your brain and your mind takes around these kinds of things, and it makes it basically wipes that clean, right? So it, between all of the neurons and the pathways in your brain, it basically it opens those up, right? And it's actually been shown physiologically to increase connections in the various synapses between the neurons in your brain. So depression has been shown to actually reduce those, right? So it's kind of that single connection. You only go one thought process route, and it's kind of repetitive and that downward spiral. So this lets you kind of use the rest of your brain and the rest of your synapses and regrow those connections and have that neuroplasticity to retrain your mind a little bit and to be able to kind of get out of that negative cycle. So it's really interesting. It kind of makes your brain malleable and flexible again, takes you out of that kind of worn-in path that your brain is typically taking in that negative thought process, and allows you to kind of get back to the point where it's fresh and clean and new and the slate's wiped clean, so you can carve your own new paths, right, and try to think in a more healthy way, and have the ability physiologically to do that. So, there are some kind of psychotropic effects to it, right? Like it's kind of a psychedelic thing if you take the drug at non-sedative levels or non-anesthesia levels. So Brittany will explain kind of, her experience on going through that little bit of a mind trip. And so there's thought to be maybe some therapeutic benefits to even that, and kind of like rehashing through, your past and past traumas, and having kind of the flexibility to open up your mind and experience like new experiences and feel connected to the world and all these cool things that it can do. But it's not just that. Like, it's not just taking that kind of mind trip. It's physiological changes that have been proven to happen and occur in the brain to improve those connections and to actually reverse some of those negative effects of depression. So really cool that they can actually see that. It's proven, like, it does something. It's not completely fully understood. Nothing about the mind and the brain really is, I feel like we're at just kind of the tip of the iceberg on this stuff, but not a lot of other things really show that demonstrable effect that this does, which is really interesting. So anyway, hopefully that wasn't too much of a crazy ramble and made sense, but that's my understanding of it from a layman's, non-medical, non-scientific perspective.
Which is much better than I could explain. Like I was trying to in the last video, and I just kind of gave up because I don't want to misinterpret something or put something out there that isn't fully true. And
no, but again, do your own research.
Absolutely.
Look it up yourself. Listen to actual doctors, but
watch YouTube videos.
Hopefully it gives you a good, kind of start to understand what it's about and know that it's relatively safe, it's proven. Go research it. And I did want to mention too that there's not many side effects after, like hardly none. Like after the first couple times after you actually do the treatment for the first few times, it is common to have headaches and fogginess, but the headaches can be reduced if you drink a lot of water, because if you are dehydrated, going in under anesthesia, it's pretty much like the same thing. Your body will react with a headache if you're semi-dehydrated or dehydrated. So if you drink lots of water, big improvement. And then the fogginess definitely goes away. But if you've had surgery and you've been under anesthesia, the waking up is pretty similar, not as intense, and it wears off in 10 minutes. Like I wake up, and about 10 minutes after, I see Josh come and get me, and we leave. So and she walks out on her own power. I don't need a wheelchair, she's totally lucid and alert and can hold conversation, so it's not like she's drugged out of her mind or anything.
Right.
I hardly notice any effects talking to you when you come out. So.
Which has not been the case for me always on actual medications. A lot of medications, a handful of them that I have tried, have given me severe side effects, and I used to take Xanax and Valium years and years and years ago, and I was almost high every single day while trying to be a mom to 4 kids and trying to work full time. It was a very, very, very dark place in my life, and that might not be the case for everyone. I'm not judging you if you are on those medications. If you take medications, that's not what I am saying. That's not what this is about. Everybody is different, but that is another reason why I wanted to try ketamine, is because of the effects. Number one, the percentage is 80%, and then also no side effects after. I don't have to wake up and take a pill every day. I don't have to be worried about, oh, I'm gonna go on vacation, I better make sure I have my meds. Like, I used to do that, and it would just like weigh over me, and I wanted to try something new, honestly. And like Josh said, it sucks that it's not affordable for a lot of people. I mean, and I'm sure there's doctors out there that will let you make payments, but a lot of them don't. They want their money up front. And so I did mention how much it cost in the last video. It was $2,100 for these 6 sessions, but 6 seems to be the magical number of sessions and treatments to have you at that cured feeling. And I did mention this before as well. It's common to need boosters afterwards in the future. There's not like a set amount, like you're gonna need a booster every 2 weeks, every month, whatever. It's all based on your individual experience and wellness. But
some people don't need it at all, though. Some people are cured after this first round.
Yeah.
How did your doctor describe what it's like?
He said that doing ketamine is like a flick in the head from Jesus. He said, if you believe in that stuff. He said, I believe in a higher power. That's what he said. But he said it's basically like a flick in the head, and it totally is like a reset after these 6 treatments. Because my original appointment with the psychiatrist was going to be waiting for Spravato to get approved and waiting for TMS to get approved and doing medications until then. And then I met with the ketamine nurse, and I was like, you know what? I could do this right away. Because medicines realistically take 4 to 6 weeks to even start.
Yeah, you're talking like antidepressants,
yes,
and mood stabilizers, and those kinds of things.
Those takes about 4 to 6 weeks to even begin
to do anything.
Right. And I wasn't in a severe dark place, but I didn't want to get there. I wanted to stop it in its tracks. And I know a lot of you may think I look happy on the outside, I look put together, my life is perfect, all this stuff. But I'm pretty good at faking it. My life is great. It is wonderful. But I unfortunately have chemical imbalance and a mental illness, and sometimes the days are dark. And I don't always show those. And I think Josh is like the only one who truly knows what we've. I didn't want to cry.
It's okay. It's good.
Winnie just do Winnie is over here, but
Perfect
she's
timing.
laying down. Josh is like the only one who truly, truly, truly knows everything that we have gone through and what I go through on the hard days. And I don't like to share it that much on my channel because I want this to be a positive, fun place. But I also, like I've said in a few vlogs back, this is my real life and this is what I go through. So anyways, so starting ketamine, the day of my appointment, my anxiety was about an 8 out of 10, and my depression was a 7 out of 10, and that is on these markers that they give you that they make you fill out. So I wrote down like what I went through on each day, and I'm not gonna fully explain or fully say everything that I wrote down, but these are some things to know if you are considering ketamine. You cannot eat or drink for 6 to 8 hours before your appointment, and nothing, absolutely nothing, 2 hours before your appointment. So you can drink water the day of, but then up to 2 hours, nothing. They will be giving you a drug test because you cannot have any drugs in your system, because a lot of opioids and street drugs can counteract with ketamine, and as well as pregnancy. If you are in childbearing age and you are a woman, you will also be pregnancy tested, which I have my tubes tied, but liability for them. So note to self, if you're gonna get it done, make sure that you drink a ton of water up until your 2 hours, and then hold your pee until you go to the office, which is extremely hard for me. They did not drug and pregnancy test me every time, but on the first day, and then they will again on the 4th day. So out of the 6 treatments. And then you cannot drink alcohol at all during your treatment either. I recommend headphones if your doctor allows it, and download like a ambient dreams or spa music, nothing with words. They said the music cannot have words in it. It'll disturb not disturb, but
it just makes you focus in on the words and what they're saying, and not like your actual experience and where your mind's trying to take you.
Yes, exactly. So that's something I recommend. The first 2 sessions, they actually had music playing, and then on the 3rd session, I asked them, I said, can I just please put my headphones on? Because even though you're under, you could still hear, you're still awake. You can still hear all the noises. So I could hear people talking in the office, and the second session, that took away from it. So I really wanted to like dive in and just have the music directly in my ears and no other sounds. So when you get to the office, you are hooked up via IV. I have to have Zofran because I've had plenty of surgeries before, and anesthesia makes me extremely sick. So I told them that before my first appointment, like I wasn't even gonna do any risks. I said, anesthesia makes me extremely sick, I need to have Zofran. So they always give me a dose of Zofran before starting treatment. On the first ketamine visit, I was given a lower dose. I don't remember how much exactly. I know it was 6 something, whatever in the vial is, because I can remember the ketamine nurse and the doctor telling each other what the dose was. So I lay back in a comfy recliner with my blanket, put my headphones in, while on the first one, listen to the music. You are hooked up to a blood pressure cuff, blood oxygen, like on your finger, the little monitor, and then also EKG. So they monitor, the nurse sits with you the entire time. She is monitoring everything, because ketamine makes your heart rate and your blood pressure go really low, almost like anesthesia does. So they are monitoring you the entire time. So the doctor reassured me that nothing's going to happen to me when I'm in this realm, in this vision. And he does say, if you see a door, go through the door. If you are scared to go through the door, go through the door, and that ketamine is going to be there to help you push through and move through your fears. So my first appointment, really anxious. I was scared. I didn't, I watched YouTube videos to know what to expect, but I was still nervous because it was me doing it, So as I began to drift off, it's black. Everything, like when you close your eyes, it's all black. But I could see like outlines of shapes, and it looked like I was looking through a kaleidoscope, but 2 of them that were like merging together. And then I would see like some neon outlines, and when the music plays, like you begin to like sink into your chair, like you become one with the chair, but then you're also floating. It's really crazy. It's also common for your hands to kind of go numb, your toes to kind of go numb, and your face and your tongue and all of that. On the first one, I did not feel that as much as the second session because the first one was a lower dose. On the first ride, I went through each of the kids' births. I was not expecting that, and it was quite weird. So Emma's birth, you kind of look through everything as a third person, but in my visions, not everything like is not like I'm watching a video. It's still dark, and there's no real like images. Like I can't really see exactly what was happening, but I know I was watching Emma's birth, and it was casted by a really like white, bright light, like hospital light. And as I was giving birth, I kept telling myself, I'm a good mom, I'm a good mom, I'm a good mom. I could hear that replaying in my head, which is something that I'm dealing with right now as Emma is getting older and she's becoming a teenager. And there's some guilt in there because I was only 16 when I had Emma and I wasn't, fully prepared. And there's some guilt and shame there. And I think that was me processing it and letting go of the guilt because I did what I did. We are here now. It's 15 years later, and we're doing great. And
which right away, right in the first treatment, that's a huge difference, even while she's mid-treatment, because like actively giving yourself positive affirmations and like saying something positive to yourself and it's kind of self-soothing never happens before that. Like that's what she lacks the ability to do, and I've never hear that stuff.
Yeah.
She has a hard time even forcing herself to fake doing that when a therapist tells her to. So for that to kind of come out of nowhere in the middle of your first treatment is a big breakthrough already in my mind.
Right. It was crazy. So then comes on the twins' birth, and that was just dark. That was a very, very dark time in my life and the things that I have gone through. And I hold guilt over that too. I hold guilt over just not, it wasn't all my fault. It wasn't all my doing. And, but that's how that went. And then Ronan's birth, which was the quickest vision snap that there was out of the 3 births. And his was casted by an orange and a pink light. And no shame, no guilt, just a quick flash of his birth. Then also during that, my visions kept pulling me back to, I call it the Morningside house. That was our first home with my kids and Josh and I's first home. Like that's when we got together. He moved into that house. This house holds a lot of great memories, but a lot of dark, hurtful memories. And I didn't want to be there anymore. I kept seeing flashes of things that happened in that house that I didn't want to be at. So I kept trying to pull myself out of that. Instead of staying there and working on it, I kept trying to pull myself out of there. And tears.
Doctor said not to do that.
I know, but I did not want to be there. I was holding so much, pain that I didn't want to be there. And so tears just start dropping from my eyes. I wasn't crying. I wasn't actively like sobbing, like I wasn't making any noise, but just I'm soaking wet with tears just dropping. I wasn't expecting that because I didn't see anybody of the YouTube videos that I watched. I didn't see them crying. So I wasn't expecting that, but I could hear myself judging myself too as I'm under, saying, why are you crying? You are always crying. Why are you crying right now? I don't think you're supposed to be crying. Stop crying. Does anybody else cry? Does this nurse think I'm crazy? And I was like, well, when afterwards, I'm like, why was I judging myself? And that's just like the story of my life.
Another breakthrough though. You would have never questioned that before this treatment.
Nope.
You just would have kept on judging even harder afterwards.
Yep. And then also, I did forget to mention when I first got in there, I was searching for Josh. I was kind of scared. Josh has always been my rock, and as much as I want to be independent in my life, I lean a lot on Josh. He's always been my rock. And so while I was there in this black, I was like, Josh, where are you? Where are you? And I could see his figure. And I could see him like at the door of the room, like of the clinic, in my vision. And that's when I did first start crying. And then Winnie was there with wings, and she was flying with me, and I was crying even more, like tears falling from my eyes even more. But that time it was like happy tears, like when I saw Josh and when I saw Winnie.
Well, I have to apologize to you for having to see this dad bod figure appear. I'll work on
Shut
that.
up. No, don't say that. And then as I'm seeing shapes still, I could see, if you guys have ever been to the Venetian Hotel, their floor looks like 3D tiles. I can see at the Venetian, the 3D tiles, and then if you look above the ceiling, there's all this art. And I was there. I was there at the Venetian. I was like, yes, this is it. Disneyland continues to pop up in every single vision, and Vegas pops up in every single vision. It might just be snippets. I might just be there for a moment. It might just, and I asked Josh, I was like, why do these keep popping up? And he's like, those are your happy places. And he's so right. Like, if I want to go on vacation, I'm just plain on me. I'm like, Disneyland or Vegas, which one are we going to? I would love to go to Hawaii. I would love to travel the world, but like Disney and Vegas just have my heart. And so I guess when I'm on these rides, I'm, experiencing my happy places. That's where my mind takes me.
Another breakthrough, positive thinking,
Yeah.
putting yourself in a happy place, having like happy thoughts about that. That never happens.
No. I'm trying to make this video short, but it's going to be so long. So hopefully you guys are still sticking with me. So the next day, after my first treatment, I did not have any treatments that day. And I wanted to just note my symptoms. I felt, like I said, really, really foggy. I felt good the whole day up until the evening. Then I felt like down, a little bit sad. I was scrolling Instagram and being triggered by the perfection on Instagram, which I feel is just not me, which is just not healthy, and which is actually something that I need to work on doing.
The world needs to work on that.
Right. It's not just
I
me.
digress.
And I told Josh while we were sitting on the couch, I'm like, I feel like crying, but I can't cry. Like it's like I'm almost numb. So I felt that was like a change too.
Because before you would never have
I would cry in an
problem
instant.
crying.
And he would look over and be like, why are you crying? I'm like, because this girl looks perfect on Instagram and I know. Really, that's my life.
Or
so,
any number of things.
Exactly.
Yeah, crying is like a daily
this, that,
occurrence.
yeah. Almost daily.
Yeah.
Yep. Okay. So, second time. This session, completely different than the first. I was given the full dose. I didn't have headphones. The music was playing in the office around me. And tried to relax. Then I did say Disneyland seems to be a recurring vision. This time I was in the Cars Land, standing right outside of the Mater ride. I was just there for a second. That was a vision. But then I began to panic. The medicine wore in deeper, and I couldn't swallow. I felt like I couldn't swallow. So I kept focusing on trying to swallow and trying to breathe. And like that took me out of where I was to be. So this time I didn't really process anything that necessarily happened in my past, like the first time where I processed the births. And I saw Mario, like
Mario
the video
Brothers,
game. Yeah, Mario Brothers. I felt like I was like floating like him, like I could bounce up in the sky and like woo, get the coins and stuff. That was really weird.
That sounds great to me.
And then I saw Mac Miller floating by. If you guys know who Mac Miller is and have ever seen the Good News music video, he's like on like a lotus flower, and he's like floating in his music video, and like his G-Wagon has wings and it flies. So like I could see that pass by my vision as I'm floating too. And same with like when Winnie occurred in the first one, I'm floating, and then all of a sudden she's flying with wings. It's all really weird, but So after Josh picked me up from this one, in the car, I instantly felt kind of angry and kind of upset, like it didn't work, because the first one, I processed things from my past. So I was thinking that's what's going to happen every time. These doors would appear that I'm supposed to go through, that I'm supposed to process, that I'm supposed to work on. And this time, I'm just floating in the abyss and don't really know what the heck any of this means. And why didn't it work? So I was upset. I didn't cry or anything because I couldn't cry. And I didn't have a need to cry or feel like I needed to cry. But I was like, okay, guess this didn't work. Another treatment failed. And this is only on treatment number 2 that my mind is already telling me it's not working. So I get home, have a headache, really foggy. I take a nap. Probably for like an hour, hour and a half. Wake up from the nap and feel renewed. Didn't have a headache, didn't have fogginess, didn't feel like anger anymore, and I felt good. The next day was my 3rd ketamine treatment. So this was on Friday. Another full dose. Felt more calm going into the appointment. This time I used my headphones because I was like, I can hear too much outside. I want to be able to really dive in with these headphones right in my ear. I can't hear anything and I want to focus. So this is kind of weird, but someone was making popcorn in the clinic, whatever, the office right next to us. And so my first vision as I'm going under, it's still dark. Everything right when you first start, for me at least, was just dark. I was in Harkins Theater. If you guys have Harkins Theater, when you go into the lobby, there used to be bright neon shaped lights, triangles, squares, circles in the lobby. So since I was smelling popcorn, that's exactly where my first vision took me, was Harkins Theater in the lobby with all these cool neon lights. Then I end up in our backyard, in the pool. And I'm on a float. And I'm just floating in the pool. And I'm telling myself, I should really come out here more often. The kids go out there nearly every single day, and I don't. I'm not really a big fan of swimming in the sun, because it just, I don't know why. But I was telling myself in this vision,
Mostly because you're a baby and get too cold.
I get too cold or I get too hot. The sun burns my skin and I just don't
Too cold in the pool, too hot outside.
Outside, right. And then I was at our old house. We've lived in this house for almost 2 years, but I was at our old house and everything was how we had it. It was when we lived there. And it's really weird. And I will say that...
Not the same house that you were talking about earlier, the bad house.
Oh, yeah.
Just the previous one.
Gosh, yes. Not the Morningside house. The Morningside house was 10 years ago. So, not that house. This, our last house, which we moved from. And I will say, too, that since doing these ketamine treatments, I have slept so much better because I dream. And I remember the dreams. And they're, vivid. And I've had several dreams that we were going to move from this house. We are moving. And my therapist said, does that mean something? Do you think you're going to move? And I was like, heck no. Heck no. I love this house. We've only lived here almost 2 years. All the houses are extremely expensive. No, I love my house. I'm staying here.
But real quick, though, that's another important big breakthrough for you is improved sleep, though, right? Because that's always been an issue. You always wake up super tired and feeling like you never got a restful sleep, and you have racing thoughts even kind of while you're asleep. And
yes.
Never remember dreaming.
Mm-mm. Nope. I will.
It's a big change. Yeah,
I will never have trouble falling asleep. I will be out in a minute. Josh will be like, "Okay, let's start this movie." He looks over. He's like, "Serious?" I'm like, "Sorry, tired." But I can sleep for 7, 8, 9 hours. Wake up and be like, "Oh my gosh, I'm so tired. I need to go to sleep again." Give me 2 more hours. And now I'm waking up earlier. The last few days, I'm waking up at 6:30 when my alarm clock doesn't go off till 7:30. Even though we're in summertime, I've been up 6:30, and I'm not tired. I'm not groggy. I'm not dreading the day. And I'm also, which I shared this on Instagram too, if you guys are following me over there, I'm waking up and I'm not instantly feeling the doom and instantly anxious, which is huge. I no longer feel a prisoner in my own body of anxiety. I wake up and I'm like, hey, let's get stuff done. Saturday, I woke up, I made muffins, I'm in the kitchen, happy, and it's just felt so good. We went to dinner last weekend, we went to the movies, and anytime we leave the house, I get severe anxiety, and it wasn't there. It wasn't there. It's just quite incredible. And I'm not just saying this because I'm sharing my experience. Everything I'm saying is 1,000% true. Like, I'm not gonna put on a fake face for this. Like I just said earlier, I'm good at faking stuff, but this is like authentically true. Like this is.
Yep, I can vouch for it.
Yeah. Back to my last experience. One song had birds kind of chirping. It's like a soothing song with birds chirping. It put me in the zoo, which I love. Love the zoo. I love animals to begin with, and like I know some people have mixed feeling about the zoo, but I could talk to the birds. Now I couldn't like talk like verbally talk, but like we were looking in each other's eyes and we were knowing what each other's were saying. Like we were mind reading but talking. It was quite the experience. So then what's it called? The show in Vegas, the spaceship show. It's
Opium.
Opium, which we've shared about that on our Vegas vlogs.
The show, they have residency right now at Cosmo, I think
Yeah.
it is. Yeah, Cosmopolitan.
When you walk in, it's meant to be like you're on a spaceship. Well, I was on a spaceship, but this time we were all flying, and he was not there, and I was like, you should have been there.
I missed out.
Yeah. That time, again, I didn't process anything like from my past, other than like Vegas, like I said, keeps popping up. Aladdin keeps popping up. I was at the where the tiger pops up.
The Diamond in the Rough.
The Diamond in the Rough. I was there because it was dark.
Who disturbs my slumber?
Slumber. Yeah, and I was like, why am I in Aladdin? Which Aladdin used to be my all-time favorite Disney movie when I was a kid. Believe it or not, none of the Disney princesses, Aladdin. And Aladdin was my favorite, not even Jasmine. Just Aladdin. So, maybe that has something to do with it. So that's going to be it for today's video. I hope that you guys are still here with us. I know it's long, but I wanted Josh again to explain kind of what ketamine is, and then me to explain my 3 sessions, my experiences. Stay tuned next week for part 2 of the final 3, 4, 5, and 6 sessions. I am staying really hopeful, and I can't wait to see where I'm at after doing these treatments and continuing therapy and hopefully doing TMS therapy in the future. Staying really hopeful. Thank you all for tuning in, and all of the love and support on my last video meant the world to me, and thank you, like from the bottom of my heart. Thank you. I hope everyone is doing well, and I'll see you guys all in Friday's video. Bye.